Hello everyone, I have such a mind-blowing topic for you today. Who knew? My mind was blown. Did you know that you can use birth control tablets to manage your symptoms of perimenopause and menopause? What? Quick disclaimer, I'm not a doctor, I'm not a medical professional. This video is only for entertainment and information purposes only, just to help you. I mean, really, this is like, it really is mind-blowing. So, I saw this concept in Menopause Taylor's video, which I will link up here. I'm learning how to do that now on YouTube. So I'm going to link to that video, and I strongly encourage you to please go and watch that one. It tells you everything you need to know about birth control for managing and alleviating the symptoms of perimenopause. Why is this information not known to everyone? I didn't know. So here I am struggling along with these now and then night sweats, just feeling weird, and sometimes not sleeping well, irregular periods that I mean, I can't predict when they're going to come. They can be 28 days, they can be 35 days in between. I've skipped the odd one. And at the moment, I'm on the copper IUD, the copper intrauterine device. It's the one that sits inside your uterus. So there's no hormones. And so I'm having what I call natural periods. But the copper IUD does make my periods heavier. The reason for that is unknown to me. I don't know why it does that. The first period I had on the copper IUD, let me tell you, was nightmarish, absolutely nightmarish. I lost so much blood. I actually thought I could just, almost die from blood loss. I know you can't, but that was the feeling. The reason I went on the copper IUD is because I thought I was under the misconception that it's not safe to stay on birth control pills for too long. See, I've got a whole lot of notes. I did a whole lot of research on this topic. So I bet you have thought that it's good to get off the birth control pills, that you shouldn't be on them for too long, that it's not safe to stay on them for life. I bet you have considered having your tubes tied if you're my age. There's so much misinformation out there, and I just didn't know. Apparently now, if you've watched that video from Menopause Taylor on using birth control pills for perimenopause, it is safe to stay on birth control pills. And in fact, if you are a healthy, non-smoking, non-obese woman, you can stay on birth control pills right up until the age of 55. I didn't know this either. I had no freaking clue. Let's dispel some myths. I think the biggest myth is that birth control pills are dangerous. And now, Menopause Barbie says directly, and I quote her, "Birth control pills have more benefits than risks." I will show you a quick screenshot of the short-term benefits that they have. And as I was looking and hearing her talk about the short-term benefits of birth control pills, obviously they regulate your period, you don't bleed too heavy or hard. You sort of minimize all the yuckiness that goes along with having your natural period, which I'm now feeling, especially now that I'm on the copper IUD. My normal periods are even worse. But here's the kicker. This is the thing I want every woman to know, especially if you're a normal, healthy woman and you're not at risk for any factors that put you in the category where you shouldn't take the birth control pill. But there are actually long-term benefits to taking the birth control pill. Who knew? The biggest one, and the one that, well, not the biggest one, they're all pretty big, but you decrease your risk of ovarian cancer by 50%. And if you take the birth control pill for more than 10 years, your risk decreases by 80%. Huge. You also decrease your risk of uterine cancer by 70%. I guess that's the progesterone in there that's thinning your uterine lining and allowing it to shed. You reduce your risk of hip fracture. Here's the one that was shocking to me. You raise your good lipids and you lower your bad lipids. Who knew birth control could do that? So they decrease your risk for a heart attack. The birth control tablet decreases your risk for a heart attack? Wow, I was shocked when I heard that. Why does no doctor or gynae tell patients this? So after I gave birth and I had my son and then I breastfed and I went back to the gynae and now he wants to discuss birth control with me. He didn't tell me any of this. He was sort of suggesting that I try the Mirena, which I tried the insertion of the Mirena, and at the time I was so faint and woozy, I almost fainted. So he inserted it. It was painful because I hadn't given natural birth. So my uterus hadn't extended. And I was lying down on the bed, and every time I stood up, I felt like fainting. And he never told me, number one, that that's a normal reaction. And then he never told me the benefits of birth control, that it's so easy to just pop a pill. And so I suffered through having this Mirena inserted, and then, because I was still not feeling well within half an hour in his rooms, he took it out. So I wasted money there. Now, recently again, I was thinking that, well, it's not good to be on the pill, so I went for the copper IUD. Let me tell you, the day of insertion, again, I nearly fainted. So they told me to lie down after the insertion, and insertion is actually painful. Well, I've never given natural birth, but the insertion of the copper IUD was painful. I kept feeling like I was going to faint, and it's really, really, really sore. It felt terrible. And then when I went to pay, I did almost faint. Luckily, the doctor and the nurse or his assistant caught me, and I had to go lie down, and I had to phone my mother and my stepfather to come and fetch me. So that is terrible. I could have avoided all that. And the cost, it's costly to get this damn thing put in. Anyway, so the birth control pill has these huge long-term benefits, and the benefits just increase the longer you're on the pill. And then the other most important one is that it reduces your risk of osteoporosis. Who knew? Now, there are a few risks of being on birth control pills, and most of the risks are these sort of nasty side effects. The only one that worried me when I watched Menopause Taylor's video was the very rare risk of blood clots, your increased risk of blood clots. So in typical Louise fashion, I had to go and do a whole lot of Google research on blood clots. Okay, the risk of blood clots is actually very, very low. Apparently, if you get pregnant, and this is now you're natural, you're not on birth control, your risk of blood clots increases far more when you are pregnant, who knew again, than just being on the pill. And apparently your risk of blood clots is higher that first year that you're on the pill because of the fluctuations in your body getting used to the hormones in the pill. I'm going to quote from www.health.clevelandclinic.org, where it says, "A woman on the pill is still at a lower risk of blood clot than she would be if she were pregnant." They also say that the modern lower dose formulations of the pill present a much lower risk than a couple of decades ago, and that the highest risk, according to this site, as I said, is during that first year that you're on the pill. Also, the most common clots, it's most common for clots to start in your legs, and there are signs that you can look out for. So immediately when you see signs of clotting in your legs, you can rush yourself to the doctor. Swelling, heaviness, and cramping in the legs. But it's such a small risk that the benefits of taking the pill do outweigh the risks. So now you're thinking, well, okay, if you're going through perimenopause and you're going to go through menopause at some point, and you are going to use the birth control pill, which is putting hormones into your body to mask or alleviate the symptoms, how will you know if you hit menopause? You see, for me, this is becoming almost a moot point now, because if it's safe to stay on the pill is going to ease my menstruation. I'm going to either be able to skip periods, or, you have the fake period, which is so light for most women. Also, it's predictable, which is great. You don't have hot flashes, you don't have night sweats, you don't have any of the signs and symptoms of perimenopause or menopause. So does it really matter exactly when you enter menopause? if you can stay, and apparently you can, stay on the birth control pill right up until the age of 55, and the reason for 55 being the number, I don't know yet, can't find an answer. I have Googled it, I'm not getting an answer yet. I will, as soon as I know, present that answer to you. But let's say 55 is maybe the age where menopause would have occurred for most women. So you can stay on birth control right up until the age of 55, and you can mask or alleviate the symptoms of perimenopause, which I'm now going through, the ups and downs, the irregularities in your hormones, the night sweats, the not sleeping, the moodiness, all of that. Does it matter? This actually explains to me why some women sail through menopause. Apparently they sail through it. Maybe it's because they've been on birth control tablets right up until menopause and they never knew that it alleviates the signs and symptoms. I didn't know this. It's still mind-blowing. So I have to get this information out there to you, and I do a lot of research. Now, apparently all these risks and benefits of birth control pills also apply to the birth control patch and ring. Again, watch that video that I linked to you, that I linked for you in the beginning of Menopause Taylor, where she goes through all the different options and the benefits and the risks. I'm not going to reinvent the wheel and go through all of it, but on www.uofmhealth.org, it says that so as to whether the patch, the ring, or the birth control tablets offer more benefits or risks, the jury's out for me, because Menopause Taylor says that the patch and the ring, because they don't get metabolized through your liver, they don't increase your risk for blood clots. But here's the caveat. All the research that I've done on Google and on all the different websites say that they might still, because it's the estrogen component of birth control pills, patches, and rings that actually increase your risk for blood clots. So she's a medical doctor, she's a gynecologist. I would trust what she's saying. However, there may be more to the story. Hopefully someone can clarify. But let me just read out. www.uofmhealth.org says the birth control patch delivers more estrogen than the low-dose birth control pills do. So the FDA warns that women using the patch are slightly more likely to get dangerous blood clots in the legs and lungs than women using normal birth control pills. See how it's hard to find exactly the truth? I know why we are all so frustrated. We all say, but I just want to know the answer. I just want to know what's really going on so I can make an informed decision. Me too. This is why I'm presenting everything that I'm learning and everything that I'm discovering here in this video for you, because I want everyone to make an informed choice for themselves, because I really do believe that that is the best way. Yes, the doctors are knowledgeable and they are trained, but they don't always have the time to sit with us as patients and explain everything to us. And maybe there's new information or new research that they may be unaware of. Look, I don't know the full story, but I do believe that the more we know as patients, the more of an informed discussion we can have with the doctors. Now, there are different kinds of birth control pills. So for me personally, I'm thinking that the birth control pill, as opposed to a patch or a ring, patch can fall off, ring, I don't like to insert things and fiddle with that. For me, a pill seems the easiest way, even if it has to go through my liver. I'm a non-smoker, I'm healthy, I'm not overweight. I feel that taking a pill is the easiest thing to do. So for me, which pill would be the most beneficial or the best way? So in the pills, you get the triphasic, the biphasic, and the monophasic, which means triphasic means that the dosages in each section of the pack, you get the, let's say triphasal, I think you get the yellow and then the brown and the whatever color tablet. The dosages of estrogen and progesterone differ to almost mimic like a monthly cycle. And then, of course, the inert pills, the inactive pills, are when all those hormones drop away and your uterine lining sheds. Then a monophasic pill is when the dosages of estrogen and progesterone stay the same throughout all the pills in the pack. You get monophasic ones where you can skip a period, and then you get the monophasic ones where you have inert pills and you can still shed your uterine lining. I did a bit of extra research in true Louise style. Here's a fun fact. All the birth control pills prevent the buildup of your uterine lining, which means essentially no risk of uterine cancer. Yay! So that's good. Estrogen is what thickens your lining according to Menopause Taylor. And again, this is the confusing part, and I don't want you to get bogged down too much because Google research says that progesterone thickens your lining, but apparently estrogen rises, your lining thickens, progesterone comes along, stops the thickening, and then when both hormones drop off, this is now in your natural cycle, your lining sheds. So progesterone prevents it from getting too thick, so if you're taking a monophasic pill, the progesterone prevents it from thickening at all. If you're taking a pill where there's different levels of hormones, it will thicken and then thin and then shed, almost like a natural cycle. Is it better to mimic more of a natural cycle, or is it better to keep the dosages steady every day? I'm not too sure. The jury's out in terms of the research I've done on that one, but it would seem that there's neither a benefit nor a risk to either one in terms of triphasic or monophasic. I think it's more your personal preference and how you feel on the pills. From what I can see, the monophasic pills are generally both hormones at a slightly lower dose. Triphasal seems to have slightly higher progesterone in it. Now, I'm talking about birth control pills. These are not bioidentical, synthetic. But now, if these pills that are synthetic hormones offer so many benefits and very little risk, does it matter whether something is bioidentical or not? You see, I always thought that bioidentical means a better fit for your body. It's closely matched to the hormones. In fact, it's a direct, almost mirror image copy of the hormones that you have in your body. So that's what bioidentical means. But does it necessarily mean that I should be trying to get bioidentical hormones into my body? Or are the synthetic ones in birth control pills and hormone replacement therapy good enough? It would seem that they are good enough. They do offer many, many benefits. And I don't know whether the bioidenticals offer the same benefits. You see, birth control tablets have the same ingredients that hormone replacement therapy tablets have. It's just the dosages of the hormones that are lower. I didn't know this either. This was another myth. I thought HRT, hormone replacement therapy, was different to birth control. It's almost not. It's almost just the dosage that's different. So different companies, different products, different formulations contain different synthetic versions of the hormones in different amounts. But ultimately, we are talking about the same stuff. And then, of course, yes, you get the bioidenticals, which is a closer mirror image to your own body's hormones. But the problem with bioidenticals is a practical one. They're hard to come by, especially in birth control pills. And birth control pills, especially for perimenopause, offer the double advantage of preventing pregnancy, because we can still get pregnant at this point in our reproductive years. And apparently the risk for twins is higher now. So who would want twins now, while you're going through perimenopause? So seeing as I do want birth control, I mean, that's obvious. I'm on the copper IUD, which makes my periods miserable. And I want to alleviate these symptoms of perimenopause that I'm going through, birth control for me seems to be the obvious choice. Maybe you are one of those women, but I want you to just walk with me in this journey and get the thinking behind how you're going to make a choice that's right for you. This is what I want to hit home, that there are choices more than we realized. I didn't realize birth control could be used for perimenopause. I'm so excited. And for me, it's almost now a no-brainer. I've been delving into the world of going the bioidentical hormone route with this doctor, thinking that that's what I need at this age in my life. And it all is because of this book. I will be back with that book. So I thought, because of this book here, Suzanne Summers' Ageless, where she talks and raves about bioidentical hormones, I thought that because I am an older woman needing to feel youthful and rejuvenated, and that my hormones are slowly declining, that this was my option, bioidentical. I didn't realize that synthetic hormones are not all that bad, and they do offer a lot of benefits. And bioidenticals, like I said, are very difficult to come by. They might be expensive. It's hard to find compounding pharmacies. You can't just get a script. You can't just go to the local chemist and get it like a year's supply. And so it's a no-brainer. As Menopause Taylor says, if you are looking for like a one-stop solution to all your perimenopausal woes and birth control pills are it. And you might have these same questions. So I invite you along with me on this journey. Let's explore it. Let's discuss it. I really appreciate you taking the time to watch this video. Thank you. I am doing my utmost best to be of service to you and to me by doing all this research and by putting our minds at ease. One of the myths about the birth control pill that all women have is that we need to take breaks from the pill to give our body's natural hormones a chance to revive, or that the birth control pill messes up our own natural hormones. Let's bust this myth right now, because let's think about it. Women are on birth control pills usually when they're young, and then they fall pregnant. Most women fall pregnant without a problem. I fell pregnant in month 2 of coming off the pill. My hormones were back to normal. I fell pregnant with a healthy baby boy. The same thing happened for my mother, and she was taking the old style, higher dosage birth control pills. Back then, they believed that they were supposed to take a break. Now, at perimenopause, if we took a break from, let's say we're going to use the birth control pill, me, for alleviating the signs and symptoms of my perimenopause, let's say I decide, well, let me take a break to just give my body a chance to refresh or whatever. Those signs and symptoms of perimenopause, like the night sweats, are going to come back. Why would I do that to myself if it's deemed safe? Thank you for joining me today. I really want to provide as much useful information as possible.